Hi, good morning all. So my topic of presentation is Sturge syndrome. I am Dr. Arundhati Pande. I am working as a head of department and professor at Symbiosis Medical College for Women at Pune, Maharashtra. So what is Sturge syndrome? It is a neurological condition, a rare neurocutaneous disorder characterized by abnormal blood vessel development in the skin and brain. There is a blood vessel malformation condition marked by a port wine stain, birthmark and abnormal blood vessel in the brain which can lead to neurological symptoms. Impact on development. It can cause neurological impairment and developmental delays due to structural brain abnormalities associated with the syndrome. So what are the symptoms and manifestations? Seizures. Seizure is very common symptom, often starting in infancy and can be resistant to medication. Glaucoma and eye issues. Glaucoma occurs in about 30 to 70% of patients and can lead to vision loss, while other eye problem may be also present. And it is associated with cognitive impairment including developmental delays and intellectual disability. So we had a 19-year-old male presented in ophthalmology OPD with a diminution of vision in the left eye. So we have investigated him in detail. So he had port wine stain, left eye no perception of light, enlarged cornea, Marcus gun pupil, glaucomatous optic atrophy. These were the perimetry changes. His right eye was absolutely normal, but if you can make out, there is a left eye, the whole visual field changes were there and the optic atrophy was set in. This patient was on the anti-epileptic drug like carbamazepine, so he had raised serum alkaline phosphatase. So X-ray skull showed frontal sinuses, they were prominent and 3 tiny intracranial calcification opacities also were seen. CT scan, linear calcification in the parieto-occipital region, prominent vessels in the bilateral high parietal and left parieto-occipital region, enlarged left choroidal plexus. His MRI also done, so it showed enhanced choroidal plexus, gyral calcification in parietal region, prominent frontal sinus. Now this patient we sent for a pulse dye laser photocoagulation because for his left eye, and we asked the patient to come for a follow-up very regularly every 6 months for his right eye. Now the basic of what is Sturge syndrome? It is a port wine stain, ipsilateral leptomeningeal angioma. It is associated with glaucoma, then diffuse choroidal hemangioma, seizures and focal neurological deficit, ophthalmos. If the child is presenting in the early age, they present with a ophthalmos. Intellectual disability, it is not inherited due to somatic mutation. And the brain MRI with gadolinium contrast is very important, and it shows a time track calcification. So when we go for the history of the Sturge syndrome, it is also known as encephalotrigeminal angiomatosis because that is the course, and is a congenital neurooculocutaneous syndrome. It was first reported by Dr. Sharma in 1860 with later description by Dr. Sturge in 1897 and Dr. Weber in 1922. That is why it is a Sturge syndrome. It has a sporadic developmental disorder caused by somatic mosaic mutation in the GNAQ gene, which is located on long arm of the chromosome 9. It is not hereditary. The incidence has been reported to be 1 per 50,000 live births. So it is a neurocutaneous disorder characterized by angiomas involving face, choroid and leptomeninges. The facial capillary vascular malformation, also known as port wine stain or nevus flammus, is usually seen in the territory of a trigeminal nerve. It is also called as a encephalotrigeminal angiomatosis, and it is the third most common neurocutaneous syndrome after neurofibromatosis and tuberous sclerosis. The neurological manifestation of SWS include atonic, tonic or myoclonic seizures. So it includes the meninges, and this is the distribution of the trigeminal nerve. So we will see port wine stain in this area. Again, port wine stain, there are various presentations. This is a picture showing all the different presentations. So this is the Sturge syndrome. We see the calcification in these areas. So what is the treatment and management? So the first important is life. So we have to manage, seizure management is very important. Medication are commonly used to control seizures, while some may benefit from surgical intervention. Physical and occupational therapy. Therapies aim to address physical and cognitive challenges, improving independence and quality of life. Laser and glaucoma therapies, they are must, though it is refractory to all the medical management, so we have to do the role of surgery is very important, and the preservation of vision is very important. Then educational support is must for this patient, and psychological counseling, because of the treatment and the long term treatment they may face psychological problems. And we have to give supportive devices like mobility aids and communication tools which promote independence and participation in daily activities. So to conclude, quality of life is very important while managing the challenges associated with Sturge-Weber syndrome. Family support is very important, and some research is still going on. So thank you so much for your patience. So now